Hello, and welcome to Unlimited Inner Peace podcast, where we delve into the secrets of finding inner peace and embracing it year round. I am your host, Julissa Ben Espinosa. In this episode, we want to continue speaking about health, self-health, or self-care. In the first episode of this month of October, we had a conversation with Dr. Andrea Thomas where she shared with us certain holistic ideas that we can incorporate into our lives to alleviate or heal depression. On the second episode of this month, we had with us RN Michelle Anderson, where she shared with us how to care for ourselves as we care for others. And on the third episode of this month, we discussed the importance of rest as self-care. Today, I want to share with you some ideas that we can incorporate into our lives or share with others that are going through or suffering from breast cancer, have gone through or are experiencing domestic violence. The month of October has been designated as Domestic Violence Awareness Month, Breast Cancer Awareness Month, and Mental Illness Awareness Month. In this episode, as I said, I want to share with you some statistics about breast cancer and domestic violence. And on the next episode, I want to speak about mental illness. So let's get started. All right, so let me share with you first some breast cancer risk factors. Gender is one of the risk factors. Women are at a greater risk than men for developing the disease. Age. Risk increases with age. Genetics. Women with a family history of the disease are at somewhat greater risk of getting sick. Having a personal history of breast cancer. Having a prior history of breast cancer biopsy that revealed a precancerous lesion such as atypia or LCIS or lobular carcinoma in situ. A long window of estrogen exposure such as early onset of menstruation and or late onset of menopause. Previous radiation such as chest radiation for Hodgkin's disease. Ethnicity. White women have a higher risk of developing breast cancer than African American women. But African American women are most likely to die of the disease at a younger age, possibly because of a more advanced stage at diagnosis or having a more aggressive type of the disease, triple negative. Asian, Native American, and Latino women have a lower risk of getting the disease and dying from it. Being overweight or obese. Long-term use of postmenopausal hormone therapy. Excessive alcohol use, especially more than one drink per day. Lack of physical activity or exercise. Not having children or having children after the age of 35. And not breastfeeding. These are some of the risk factors of a breast cancer. Now, I want to share with you certain things that we can do, some ideas that self-care ideas that we can incorporate into our lives if we are the ones suffering from the disease, or we can share with others that we know are going through this. I know that each one of us know at least one person that has gone through this and have survived or is no longer with us. All right, some of the self-care ideas. Number one is schedule a self-breast exam. Every month, take the time to self-examinate. Take the time to self-examine your breasts to see if there is some abnormality there. Early detection is key in breast cancer prevention. Wear pink to show solidarity. I'm wearing pink today as I record this video. And a couple of weeks ago, I participated in a women's conference where all women wore different shades of pink in solidarity. Donate to breast cancer research. Consider giving to organizations that conduct research, because these organizations not only conduct research, but these organizations also can help women that cannot afford treatment. Create a care package for someone that is undergoing treatment. Show compassion by creating a package with maybe a blanket, little socks like a cozy, skincare products, tea, things like that. And also you can include in that package a handwritten note to that person that is undergoing this treatment to show your support. Prepare a nutrient-dense meal. Eating healthy is a vital part of self-care, especially for those who are undergoing treatment for cancer. Practice gentle stretching. Gentle movement can help with healing. Simple stretches can improve flexibility, reduce stress, and promote a sense of well-being. Rest. Allow your body to rest. Remember, we spoke about rest in the previous episode. Educate yourself about breast cancer prevention. Stay informed about the latest research on cancer prevention and lifestyle changes that can help you with this disease. You can also join a support group where you can meet other women that are going through this, and also family members of those who are going through this disease. And also explore alternative therapies like aromatherapy. Complementary therapies such as aromatherapy can be a great support for healing and for reducing stress and for reducing or managing pain. I'm going to share below on the description of the video links where you can find resources, where you can find more information about breast cancer. Now let's move on to speaking about domestic violence. Let me share with you some general domestic violence statistics. An average of 24 people per minute are victims of rape, physical violence, or stalking by an intimate partner in the United States. More than 12 million women and men over the course of a single year. 12 million women and men. That's a high number. Nearly 3 in 10 women, 29%, and 1 in 10 men, 10%, in the United States have experienced rape, physical violence, and or stalking by a partner and reported it having a related impact on their functioning. Just under 15% of women, 14.8%, and 4% of men in the United States have been injured as a result of an intimate partner violence that included rape, physical violence, and or stalking by an intimate partner. 1 in 4 women, 24.3%, and 1 in 7 men, 13.8, ages 8 and 18 and older in the United States have been the victim of several physical violence, but severe physical violence by an intimate partner in their lifetime. Intimate partner violence alone affects more than 12 million people every year. Over 1 in 3 women, that is 35.6%, and 1 in 4 men, 28.5% in the U.S., have experienced rape, physical violence, and or stalking by an intimate partner in their lifetime. Almost half of all women and men in the United States have experienced psychological aggression by an intimate partner in their lifetime. 48.4% and 48.8% respectively. Women ages 18 to 24 and 25 to 34 generally experience the highest rate of intimate partner violence. From 1994 to 2010, approximately 4 in 5 victims of intimate partner violence were female. Most female victims of intimate partner violence were previously victimized by the same offender at rates of 77% for women ages 18 to 24, 76% for ages 25 to 34, and 81% for ages 35 to 49. These figures are very alarming. And these figures are only here in the United States. Domestic violence is an issue that we can see all over the globe. And I'm sure that each one of us know at least one person that has suffered from domestic violence. Now I want to share with you some ideas that we can incorporate into our lives if we are the ones experiencing domestic violence, or if we know of someone who is experiencing domestic violence. I'm going to share with you also a link where you can find information about domestic violence and inform yourself. Know what's going on and how to help. All right. Some self-care ideas related to domestic violence. Educate yourself on the signs of domestic violence. Understanding the signs of domestic violence is crucial for helping yourself and for helping others. Create a safe and calming space at home. Transform a corner of your home into a sanctuary where you feel peaceful and safe. This could be a place, a space for relaxation, for reflection, or simply for resting. Practice setting healthy boundaries in relationship. Boundaries are essential for emotional well-being and safety, particularly for survivors of domestic violence. Join a domestic violence awareness event. Many organizations host events during the month of October to raise awareness about domestic violence. Reflect on healthy, supportive relationship. Take the time to reflect on the relationships in your life that bring you joy and bring you support. Volunteer at a local domestic violence shelter. Supporting shelters that help survivors of domestic violence or supporting these places is very meaningful. Is a very meaningful way to give back to the community. Take a self-defense class. Empower yourself by learning basic self-defense techniques. Write a letter of encouragement to a survivor. Words have power, and the Bible tells us that life and death are in the power of the tongue. Engage in an emotional release activity like journaling or art. And create a personal safety plan. If you or someone you know is experiencing domestic violence, creating a safety plan is crucial. It includes identifying safe spaces, emergency contacts, and steps to take in case of danger. A personal safety plan offers a sense of security and preparedness. Now, like I mentioned before, I know that each one of us know someone who have been dealing or have dealt with breast cancer or have suffered domestic violence. And it could be even ourselves going through that. So here, this is by no means extensive information. As I mentioned, I will provide some links and some phone numbers where you can reach out. You can go there on the web to find more information so that you can be more involved, you can be prepared, and you can have more information about these two issues. Thank you for watching, and I see you on the next episode. Bye-bye.